Hello,
Hello.
everyone. Welcome, Dr. Katie Kangas. Thanks for coming on today. It's Friday. Happy New Year.
Yes.
Can you believe
Okay.
it? 2025.
Yeah. Great
I wrote
projection.
my first 2025 today, and that was weird. I'm going to write 2024 for the next 2 months, probably.
There's a lot of great, though, spiritual and planetary alignments with 2025 being a good year.
It's going to be a good year. I can't wait. So 2025, that means that 2025 is coming up or is here. And we are 7 months away from the third The More You Know Pet Wellness Summit. And for those of you guys who are tuning in, you don't know, Dr. Katie Kangas is one of our very esteemed speakers, and I cannot wait to have you here. You were here last year more as a sponsor, vendor, guest, and participated on the panel at the end with Dr. Karen Becker and Rodney Habib for the Inside Scoop. And you were here for the coffee talk and kind of participated in that as well. Yes, Innovative Pet Lab sponsored that. And
thank you. Got my mushroom coffee with my cocoa therapy MCT oil in here today. So
I love it.
Super representing.
That was the coffee talks you here, but this year you are coming back in a bigger way, and everyone's going to get to hear from you for like an hour and a half and all the cool things. So we're here to talk about kind of a little teaser about what we're going to be diving into for the summit, like a shorter version of it. And I think, what we're going to talk about is such an important topic. And I think if you have a pet at home, if you are not going through some of the things that we're going to talk about today, at some point in their life, you are going to go through it. And you're going to be asking these questions, and you're going to be wanting to know, what do I do? Oh my gosh, I heard XYZ online, and this person's yelling at me to do this, and this person's yelling at me to do this, and I don't know what to do. And it's confusing because Google says one thing, your neighbor says another thing, your vet says another thing, and so we wanted some insight from you. And so I would like to point out, if you guys have questions, please feel free to ask questions. I will say no direct medical questions. These will be hypothetical. She is not seeing your pet. This is not a consult. So they will be hypothetical questions, but ask away and I'll let you go from there.
Thank you. Such a great intro to this unique topic. And so I think the title of my presentation when I'm there in July for the summit is going to be Navigating Pharmaceuticals in a Holistic Approach to Healthcare for Pets. And so this is such a unique topic. And the first time I'll be presenting it. So this is really fun. I'm going to come up with a lot of, new material, and we'll talk about, a lot of the tidbits and bullet points today. But I have found, over the recent years as well, and I'll just back up and say, I've been a veterinarian for 30 plus years now. I've been holistic and integrative for more than 15 years. And so obviously I'm integrative, and I'm rooted in the knowledge and the education from the conventional side, as well as all this wonderful, knowledge basis to share with my, clients and pet parents with the holistic side of things. But what I've seen in the recent years is, there's such a dichotomy in the belief system of getting to the point where people are feeling so much either, fear or judgment around using any pharmaceuticals at all in conventional medicine. And I want to just remind everybody that, first of all, an integrative approach is we're expanding our toolbox so that we have so many options to use the best of both worlds for our pets and ourselves. And there are very, certain circumstances where using pharmaceuticals can be very necessary or very indicated. And so we don't want to necessarily pit them against each other and say only holistic is good. Holistic is amazing. And that's our goal, is to support the body with its innate brilliance to be healthy and be in balance with good nutrition, quality foods, plant medicine, homeopathics and herbals that support the body's natural rhythms to perform well and be in optimal health. But we all know there are circumstances where there are either trauma or crisis when your body is in, or your pet's body is in a crisis moment, whether that's trauma and injury, or whether there's a disease that just tipped into crisis point, like diabetic ketoacidosis or congestive heart failure or something, there are times where medicines and conventional therapy shine, or surgery, trauma
Or
surgery.
you just
Break something, you get in a car accident, you have a pneumothorax, it's like, hey, this is what we want conventional medicine for. But there are also managing of some chronic things, or just bringing the body out of a crisis point, that we want to turn to our Western medical options. And then we get to, complement and follow up with our holistic tools to really bring the body back into balance and true healing, or at least in the best capacity that the body can be in dealing with that health situation. And so I really wanted to, support all the pet parents that, are listening, and that will be attending in July, to have sort of a healthy understanding, where we do want to have caution around overusing
Mhm.
pharmaceuticals, but we also don't want to demonize them and label them as bad. And I see so many pet parents that are like, I don't want to use anything. I don't, even in situations where it can be appropriate.
Or the
And
opposite, which is a quick fix for something pharmaceutical, not trying
exactly,
the other thing. So I mean, it is
it's
a
both.
back
Yes.
and forth thing, and there's a lot of questions and a lot of different opinions on this. Really quick, hi Martina, I want to say hello. She said hello, and also she did ask a good question, and I should have said this in the beginning for the summit. Yes, tickets go on sale to the summit Tuesday morning. Here's a note about that: if you have not signed up for first access tickets yet, the only way to get tickets Tuesday morning is to sign up for that. I'll post a link in the comments for that. And fun fact, I don't know what's going to happen Tuesday morning, but the last summit did sell out in 36 hours, and the VIP ticket sold in 18 minutes. So be on the safe side and get those. But there's been, I'll put a link in the comments, but also if you go back onto our social media page, you'll see the link for that too. So just had to throw
Awesome.
that out there real quick.
Yay. But thank you for right before, that great topic of leading into, it's also good to be very informed and, knowledgeable about the systems of when medications are obviously overused or inappropriate, understanding that reaching for them for the quick fix. And oftentimes, of course, a lot of conventionally trained veterinarians, that's kind of that's the
Right.
direction that they go in oftentimes, is let's just use this. So there are a lot of situations, whether it be antibiotics for skin, or corticosteroids for skin, or Apoquel or whatever. There are a lot of situations where we want to be informed and thoughtful about when is it inappropriate and it's a quick fix, or it's being overused, and when is this potentially a good choice to use as a temporary solution, and
Mhm.
in a few circumstances, sometimes a long-term solution, if we have to manage congestive heart failure or something like that. If you have
I
diabetes.
have a dog in congestive heart failure now. She's 17-ish, older years old. And you know what? We're at end of quality life, right? She was my hospice dog. I've had her for 2.5 years and kept her off of medications for 2 years. And at a senior age, and that was doing all of like my natural things. But now we're at the point where I need something to continue her quality of life, or
You
it's the
got it.
end.
That's exactly it, is that there are wonderful tools we can use in plant medicine and other categories to support cardiac function and to lengthen the body's ability to, thrive, and or still be having good quality of life, until we get to the point where the disease is more advanced.
Right.
And by using our holistic tools, just as you did for your dog, we are going to prevent the need from tapping into the pharmaceuticals, maybe forever, but certainly for an extended period of time. But once the body tips into congestive heart failure, because like, just because your pet has a heart murmur doesn't mean obviously that we're going to go
No.
use pharmaceuticals and drugs. But once the body tips into congestive heart failure, where it's hard to breathe and there's fluid building up in the lungs, there's still things we can do holistically to complement that. But that might be a time where we need to turn to medications to support their quality of life for as long as we can. And there's a nice balance between, complementing with the pharmaceuticals, using our herbs and other things to make the outcome the best outcome it can be.
Right. Absolutely. You were talking about earlier before we went on a story that you wanted to kind of share and
Yeah,
kind
thank
of
you.
that
So, yeah,
amazing.
so this is probably a nice thing to just, give people a perspective of why I think this is such a great topic. But my practice manager Jessica, who I met 2 to 3 years ago now at a conference, at a pet health conference that I was speaking at, she has a dog named Rusty, a cocker mix, and when we met, he was tremendously sick, unhealthy, and his diagnosis was IMPA, which is immune mediated polyarthritis. And he was in tremendous levels of pain, to the point where, he couldn't get up. He was absolutely miserable, very, very poor quality of life. And Jessica was trying everything she could to support him to better health through natural means. And she was avoiding the use of prednisone because she thought, with all of the, knowledge and training she had, and, going to all these educational things for holistic pet health, that using prednisone or steroids was bad, and was really trying to avoid it. And so she was doing all kinds of, holistic healthcare, from herbs to acupuncture and chiropractic and laser and all these wonderful things. And Rusty was at the point where he was so miserable that she was crying with me, saying, "I think I'm going to have to let him go. This isn't fair to him to keep going." And she brought him to me for, that after we met, she brought him to my practice, my clinic. And so then I really delved into his history and, what have you done and what can we do from here? And I said, "Well, have you used prednisone yet? That's the standard treatment for an autoimmune crisis, when the body is in this crisis point." And she's like, "No, I didn't want to. I thought that was bad. I thought pred would kill him." And I said, "Well, you're thinking about euthanizing him. You're looking at, so when we're talking pred versus death, like, hey, let's choose pred." you know
Right. 1000%.
right? I mean, we're up,
Been
and
there.
just,
I've been there and done it.
yeah. And she said, and she was so sweetly vulnerable in that moment, where she said, "Oh my God, I never thought of that context." In her mind, it was so bad to do that she was literally ready to let him go, in choosing that other alternative. And what I said to her is, I said, "We're not going to have to use pred forever. It's not like he's deemed to a
Nope.
lifetime of prednisone. This is a short-term thing to bring him out of crisis, because right
Yep.
now his body's in crisis. This is where conventional medicines or Western medicines can shine in appropriate circumstances like this, to bring him out of the crisis, while we're doing all these other good holistic tools to then keep him healthy and get him back to a healthy state. And then we can let go of the pred and wean it off, etc." 2 years later, Rusty is 100% pharmaceutical free. I think he's been pharmaceutical free for at least a year and a half. And his quality of life is amazing. The dude's running around and zipping around all the time. And so he's such a great success story. And Jessica really sort of encouraged me, please get his story out there and share with pet parents, because she said to me, which was such a beautiful compliment, she said, "You are the first integrative veterinarian that told me it was okay to do this," and that, she used the words, "gave me permission to do this." And that really hit me, in that, there's so many good tools and good strategies on the holistic side, but we don't want to throw the baby out with the bathwater and just say,
No.
everything else on the other side should not be used. And so, if that story helps anybody in their journey, or just understanding, I think, the value of this discussion, then, Rusty and Jessica will be very happy, and so will I.
Well, again, I mean, I said in the beginning, it doesn't have to be an all or nothing. Like, it is both. And some things can be for, a short amount of time. Some things are more long term. And it's finding that balance. But I think that's a key too, is finding the balance between it,
Absolutely.
right? Because
Absolutely.
it's very overwhelming, and you get a lot of things, and you need to have some patience as well, and I think when you're looking at, the more holistic side of things, it doesn't always work immediately, whereas your pharmaceuticals tend to. So, and I've had this conversation with many, customers that come into the store, and I'll be the first. I don't love pharmaceuticals, but they are needed. I don't like how much they're overused for things. Like when someone comes in here and they're on XYZ, and I'm like, oh, I could have fixed that very quickly with like a natural remedy and it not have the side effects. But, if you're, like you said, if you're in a crisis mode, I always think use your, natural products, use your pharmaceutical, get it where it's to a manageable point, and
Yep.
then wean off of that and continue. And
Yep.
patience is key here, because I do think, people want a quick fix. I mean, I eat Apoquel, right? I mean,
Right.
the one that we all kind of hate. But, it's get it to a manageable point and then start using your natural things to wean off of it. So like in Rusty's case, he's not on pharmaceuticals anymore. He's not on Pred anymore.
At all. None. Zero. And that's the beautiful thing. And, just like you said, just putting it into context of, there are situations where we don't need to turn to pharmaceuticals at all. So in the presentation that I give at the summit, I will run through different, common health conditions of pets and say, which situations can you avoid pharmaceuticals altogether? I mean, if your pet has diarrhea and you go to, most veterinary hospitals or urgent cares or ERs, one of the standard treatments is just throw them on metronidazole. And it's like,
Right.
that's almost never needed. Like we have better tools from the holistic side.
Way better.
Way better. And so, and, like you said, throw in prednisone or antibiotics at every little, skin infection or dermatitis, absolutely inappropriate. And so, we want to look at what conditions are there, common overuse of medications. What can we do as wonderful holistic alternatives to get better results? And not always quick, but sometimes, holistic stuff will, create even quicker response than people expect. But patience is key, because a lot of times, depending on if it's chronic, condition, it is going to take some time. And, that's where we really want to look at the balance of everything, just like you said.
And that's, I might be kind of going off on a different tangent here, but, chronic things, we always talk about gut issues, and a lot of chronic things are related to gut health. And you held up a mug there a second ago. And I just want to point it out, because we've had a lot of customers who have like IBD, and, Pred is so popular, for IBD and things like that, where, there's at-home testing that either you can like buy in a store such as myself, you do testing, integrated with, to figure out like what is going on the inside, so you don't have to turn to these,
exactly,
not such a guessing game. I guess that's the better, like,
testing is key. And every integrative practitioner on the veterinary and the human side, we love testing, because the more appropriate testing we're doing to figure out what's going on with that individual body, the more customized we can be with the approach. And I will just say, since you brought up IBD, I mean, my goal and gut health is a big, focus of mine. And I'm really into the functional medicine, aspect of resolving gut health issues and chronic gut health problems. And prednisone is, I mean, I'm almost always able to achieve getting my patients off of prednisone. And definitely when patients come to me with IBD, I don't even mention like that's
Right.
not a condition. So this is like a great topic for, the talk. That's not a condition where I would turn to almost ever, pharmaceuticals. But there are other conditions where I might. And so it's really nice for people to have a good knowledge base of, what things would be appropriate in which category. And, when it comes to pharmaceuticals, there's vast overuse. We know that. I mean, there's overuse with everything from antibiotics to, all kinds of drugs and medications. But, there's sort of two situations of it being overused. Is one is it was never necessary in the first place. So let's talk about those conditions which didn't even need that. We could turn right to holistic and just go, forward with all of that. And then there's other situations where it might have been indicated initially for a temporary use, but Western medicine doesn't know any better of any other alternatives and solutions. And so the overuse can be just, it was never necessary, or it can just be that the patient is, kept on it for way too long. and it's starting to do a disservice with, side effects or being combined with other things. I have patients, which, everybody who does what I do also sees. I have patients that come to me on massive polypharmacy. I'll have patients that come to me that are on 10, 11, 12, up to 15 medications at the same time.
That's crazy.
And it's so, yeah, I mean, it's just unnerving. It just gives me a pit in my stomach when I see
Well, it's
that.
like the side effect of the side effect. Let's treat the side effects, and it's the same thing in humans.
All of those, and it's just yeah, so clearly excess, overuse, all that kind of stuff, and we always want to work on that. That said, when patients, when pets come to me and people say, I want to get them off, meds, or get them off all meds, we also have to be very thoughtful and individualistic with how we're going to do that. And what meds, I can look at a list and delve into the history of the pet and talk to the pet parent and help them decipher, hey, these three things these are not necessarily, we can just get rid of these few things. These other things, let's start strategies of testing first to figure out what's going on if it hasn't been done, and what strategies can we start with our holistic tools that we can start dropping these meds out one by one, or weaning them down, etc. And we might get to the point where they're on none, or we might get to the point where they came in on 12 and they only are on 3 for more long-term use, etc.
Right.
So it's really great to, work with an integrative veterinarian or practitioner that can really help support that individual plan, because that's the other part of integrative medicine that is such a beauty, is that you hear the sort of phrase, the N of one, N meaning your sample. Like, you are a sample of one, you are an individual, the whole body presentation of that person or that pet person, and that is very individualistic, and what might work for somebody else doesn't work, for your pet, or vice versa. And so it's really great to work with somebody who has all that in mind and can sort of put that wellness plan together. And that's why I offer, telehealth and telemedicine to support people through this kind of process.
Well, and that's what I like about, integrative veterinarians and holistic veterinarians, is that it's not here's the symptom and here's the fix. It really is trying to figure out what is the reason. Let's find, pinpoint where it is in the whole body and find out why this is happening. Like, let's not just stick a Band-Aid over it and call it a day. Let's try to actually fix the problem. I mean, if your dog has an allergy, yes, Apoquel is going to, make the allergy, quote unquote, go away, but it doesn't actually make it go away. It just suppresses the immune system, and the allergy is still there.
Right.
Why is it there?
Yeah, it's a symptomatic relief, but it's not dealing with the actual problem. And sometimes symptomatic relief can be a godsend when you're self-mutilating, or, so I'm not saying that it's always wrong, but it's definitely shouldn't be our go-to. And we should not rely on that being the solution, because it's not a solution,
No,
And so, yeah, absolutely. And so that, as you said, I mean, finding that balance, and always from an integrative and holistic approach, and what is appropriate, is getting to the root cause and doing our best to decipher, where's the origin of this, and then supporting the body back to a healthy, balanced state.
And I would like to, bring up how you just said that you do telehealth. So for those of you that are listening and you don't have a great holistic or integrative veterinarian that you work with, you can contact her and she can do it. And we did a talk about this back over the summer. You and I did, our spring, I don't know, it's on our YouTube if you go and find it, but we talked about how, you don't have to actually see a pet to, be the veterinarian, and you work through lots of things together. So you can touch on that, but there's also a whole episode, where we spoke over in 2024 about that. So
yeah, telehealth really is so effective in this type of situation, because a lot of times what pet parents really need is somebody to help put all these pieces together for them, and really looking at a whole body approach. And one of the downsides of Western or conventional medicine too, is that oftentimes it views a health problem as a single issue. That body part is having a problem, so let's give medications that alter the symptoms, and often a Band-Aid approach. But addressing one system at a time. And of course, we know that everything is connected. And from a holistic approach, not only do we want to include body, mind, and spirit in there, in our approach to true wellness, but also that the body is a vast inner working connected series and entity. And
Hmm.
so one system is definitely, I mean, everything's connected. And so oftentimes I get patients that have several different health issues going on, and they're all being treated by very separate approaches, rather than really integrating that and saying, how can we support this body in its whole entity to bring these systems back in balance together.
That's good. Jessica Lee did post the link to your website if someone wants to get in contact with you. But you have a question from Julie. What are your thoughts on PEA? P.
Oh, the PEA supplement for
Mhm.
anti-inflammatory?
Yes.
Yeah, I would totally recommend it. And the thing is, there's so many circumstances that is beneficial in. So I would absolutely support its use. And there's a whole category we could talk about with alternatives for pain management and inflammation in general, and that's one of them. And as most people know, I mean, certainly any chronic disease, and obviously any painful acute kind of things, inflammation is involved. So anything we can do to address inflammation is always beneficial. But PEA can be, a really nice adjunct for pain or inflammation.
Can you use that with other pharmaceuticals and other things with no side effects?
I am not aware of any contraindications or, situations where that would interact with anything.
Okay, that's good.
Yeah.
If anyone has any other questions, feel free to drop them in the comments and see if we can answer them. But yeah, I mean, I just think what this could be diving into a lot of things, and I know most of this is going to be talked about at the summit, so I don't want to give too much away. But like, could you give me a few examples of overuse versus where things could be like used critically, or you see where I'm going with that? Like, what are some
Yeah.
common things that you come across where someone doesn't want to use something or should be and whatnot?
Right. Yeah. So I would say, since gut health is such a big cornerstone of what I talk about, that's a good place to start. And I did mention already that, metronidazole and, prednisone, all these things for IBD, even immunosuppressants like cyclosporin, those are things that we don't need to use really ever for that kind of situation. And so many alternatives that can be used that are more effective. And again, back to the testing, things like the gut health check from IPL would be very beneficial. Microbiome testing, all of those kinds of things to see what we really need to do to support that pet. But commonly used herbs are so beneficial for things like even acute diarrhea or chronic gut health problems, like slippery elm and marshmallow root and, the colon rescue formula that I use so frequently. Diarrhea, I often will turn to clay, Espellardi, of the, unique probiotic. That is such a beneficial, product to be aware of. Even when it comes to parasites like Giardia, there are the Solutions Pet Parasite Free is one of my favorite formulas for anything parasite related. That is very effective and can be used for either a deep parasite cleanse if you use it daily for 30 days to just do like a lot of people are becoming aware, even on the human naturopath side of things, with latent parasites potentially causing chronic issues and inflammation. So there's things we can do with holistic tools there, but even a 10-day course of this, natural, the parasite free formula can absolutely resolve Giardia.
Wow.
So whereas obviously in a conventional setting, you'd be going for the standard dewormers and the metronidazole, which
Yep.
further offset, every time we use
Messing that up
metronidazole,
even more.
we further damage the microbiome. And when we can always do, and if that happens, I mean, sometimes people come to me and they're like, oh, my pet had pneumonia and they had to go on antibiotics. And and I get that, we did have to use that, but now we get to dip into the holistic integrative side to build the body back up and get the microbiome back in balance and all of that. So it's it's great to use all these tools proactively for preventative health and keep them as healthy as we can, so we don't have to turn to pharmaceuticals. But when they are needed, then we get to come in afterwards with all of our support tools to bring the body back.
That's
So
great. And I would like to touch on something you said. You just brought up some herbs, and just want to bring up that if you don't know, Rita Hogan is also one of the speakers for the summit, and she has a fantastic book that will be coming out in a month from now, actually, on February, all about canine herbalism, and it's really easy. She's kind of made it an easy how-to guide. So herbs, and you were just talking about, those can also be really, really helpful. And if you're watching, please come back and watch this upcoming Monday at 4 p.m. because I'm going on here with Jamie from IPL and Rita, and there's a spoiler alert happening, and you know about it, but I'm not saying anything else, so you're going to want to watch. We do have some questions. I don't know if you want to answer some of these or not, but this one, do you know anything about Rainmaker P-Tabs for pain?
that is so interesting because I knew nothing about that supplement
I don't
until
know about it, actually.
a couple days ago. One of my new patients is on it. So anytime I'm, getting a history on a patient, if I see that they're on anything that I'm not familiar with, I go look it up. So I did, and I was familiar with Rainmaker with a couple of other things they make that I've, seen some of my patients on. But the P-tabs are for pain. And there are some vitamins and amino acids and things in there, as far as I could see. And I wish I could speak to this a little better because I didn't highly study the formula, but I looked it up and looked at it and went, huh, that's interesting that it didn't look to me like there were a lot of specific things in there that I would have thought would have made it great for pain. But all good ingredients, okay? But nothing that I saw that was really specific, like typical, pain protocol. But I will say that this particular dog, who was an old, a geriatric or older golden retriever who is on it, his mom told me she started that Rainmaker P Plus 2 months ago, and that her dog was so much better. Like his was
Wow.
doing way
I
better
haven't
on his
heard about it,
dog.
actually.
He
So
was more
that's very
energetic.
good.
And I was like, wow, I gotta look at this because that particular dog got phenomenal benefit from it. So
Okay.
I would say from the little bit I know, thumbs up on, at least trying that. So
what about ashwagandha?
ashwagandha, love that herb. So ashwagandha is a adaptogen herb. If people have heard that word, adaptogen or adaptogenic, that means that it's helping the body to adapt to, imbalances or physical or emotional stressors. Okay. And so the adrenal glands are very much known to be plugged into the system in our body, where when we have to deal with stress, whether that is emotional stress or physical stress, like chronic pain or chronic itching, or the fear, anxiety, those kinds of things, that the adrenal glands and other systems in our body are in charge of trying to regulate and smooth out that stress and help the body deal with that better. And ashwagandha is a superstar in that category.
Okay.
So a good adaptogen. A lot of pets and humans are under chronic stress. The other fun thing about ashwagandha, which is
We
from
all are.
yeah, right. We all are. I mean, we truly
And
are.
if you're stressed out, your pet is too, because they're picking up off of it. So my poor
Exactly.
pets are probably all stressed out.
Yeah. And the beautiful thing about ashwagandha from the Ayurvedic toolbox is that it's known to support calm, non-reactivity. You feel calmer and more relaxed, so relaxation. But at the same time, you think more clearly, and you just, it's like a chi, like it builds you, like you have energy, but you're calm at the same time.
Okay.
So, it's a really nice balanced herb. So
Great. Let's see, another question. I know her dog is being treated for this right now. Do you have any natural treatments that you know for Ehrlichia?
for Ehrlichia, so tick-borne stuff. I mean, I would, there are actually there are herbs that are made for either prevention of, tick-borne diseases, but there are also herbs that can help too. And that, I bet Rita would definitely have
I was gonna
some.
say, I know that's definitely a Rita question.
Yeah, because I know there are some specific herbal formulas that I have pointed people toward. There are certainly homeopathic formulas as well. But then, just from, again, an integrative standpoint, depending on what's going on specifically with that patient, there are other things that we could do too from the herbal and natural realm, whether it's blood builders or immune system support, etc. So generally, even with any diagnosis, you're going to come from an integrative approach with many different angles of how do we support that patient, you know, through the resolution of this particular problem.
Okay. And then a couple more questions here before we wrap up. Where did that one go? Losing. Where did it go? Do you again? This might be a Rita question. Herbs for diabetic dogs?
Yeah, so there are herbal formulas for diabetic dogs too, and I think that she would do better with that question. There are Western herbs that you can use, and there are always Chinese herbal formulas that are
Herbs
specific.
are like a huge that
Such
is the one thing that I know like this, I know the basics, but talking to Rita and she just starts
right.
spouting off
Yeah,
things that I'm like, I've never even heard of that before. So
right.
Rita's going to be back here Monday at 4 o'clock.
Yeah,
So,
yeah.
and
There are
she'll be at
herbs
the
that
summit.
there are
So,
herbs that help to regulate blood sugar, but then there are also herbs that help to, or even other supplements that can help to regulate, pancreas and liver function and all that kind of stuff that's involved with the regulation of diabetes. So
and then lastly, this one's asked, do you have a hair tissue mineral analysis test that you like?
yes, I like Parsley Pet.
Parsley Pet.
So
I've heard
that,
great things about Parsley Pet.
Chelsea Kent reviews all of those, and she has, such a detailed, very very helpful form that she or assessment that she does around those results, which is really fantastically done
So
in
what are they testing for? Like what are we using the hair testing for?
testing for heavy metals and toxins, and
Okay.
then also testing for ratios of minerals. And oftentimes, if one mineral is in excess, it's the balance of the two that create either the problem or the deficit in the body. It's not always just looking at one mineral. So we see is magnesium low, or is copper high, or things like that. Zinc and copper have a relationship, etc.
Mhm.
But when certain things are out of balance, one thing is high and one thing is low, then that creates even more of a problem. So it's really looked at with a very comprehensive viewpoint, and very specific things with the Parsley Pet result sheet that you get really supports through different things that you can be feeding and different supplements, even ashwagandha oftentimes she mentions, because that report also reflects what's going on in the endocrine systems, and it reports on the balances going on in the pituitary, thyroid, and adrenal systems too.
Okay.
So, and plain and simple, a lot of people just like to look at it and make sure, my pet's not high in mercury levels and, these other toxic things that, we could get metal chelators and other treatment strategies going if they're showing specifics with, high toxicity of certain
And
toxins.
just like Jamie said from IPL, she stresses this a lot when we're talking that you shouldn't just it's just kind of like your yearly blood work, right? Like you don't just test for it when there's something wrong. Like you should always kind of have a baseline for these things, knowing
Yep,
that way if you do it and then in 2 years or a year from now it's off, like you have something to go back to
yep,
see.
absolutely.
And
And
Judy
the other,
talked about that as well. That
yep, absolutely.
really
Testing. And the other thing I can just briefly point out with the hair and mineral analysis testing is that that when you test blood, it's like if you're doing a blood test for certain minerals, that's not going to actually accurately reflect what's in the tissues in the body. So just to set that, you know, a, just to drive that piece home is why is the hair analysis a worthy test to do, is because what is in the hair is a direct reflection of what's actually in the body cells or the tissues,
that's a great
depending on where the growth of the hair is too, because there's going to be a time frame in the
course.
length of the hair with what's going on with reflecting the past situation for the body.
Well, I'm so excited about July. I mean, this is such a cool topic. And like I said, everyone who has a pet, these are all things that if you're not going through it now, you will at some point because, as our pets get older, there's more ailments that come about and diseases and, different things. And so you do have to face the should I do this or should I not do it? And you do have people yelling, in your ear, one thing or the other. And I think this is such a great topic that is going to be useful for everyone. It's,
Thank
you will
you.
use it at some point. So
Yeah,
I'm so
absolutely. And I
excited.
really want to create a knowledge base for people of, when can they just feel really confident about these are the holistic tools that will work in these situations for my pet. And what are the situations where, maybe I need to be looking at some other alternatives. And oftentimes the other thing I can say is when you get into the point where you have to manage something with pharmaceuticals, the other recommendation that I often make is to work with an internist, an internal medicine specialist, or a specialist that is in the category of health that your pet needs help
Use
with.
your people.
Exactly. You want your integrative and your holistic team, but you also want a specialist because a lot of times um, complex issues for pets, if they're handled with the general practice veterinarian, may not be dealt with as well or as targeted as other
And I like
options.
to use that with, it's the same thing with human vets. Like we have different doctors for various things.
Right.
Your pets should too, and so, use your people and form these relationships with, your vets and your different veterinarians and your nutritionists, et cetera, before the crisis happens. It's good to have these relationships because let me tell you something. I don't know about where you are, but I can tell you around here, it's real hard to get an appointment in somewhere right now, especially for a new patient. So, go ahead and have those people in place and get to know them and do your wellness checks. So when crisis happens, and hopefully it doesn't happen, but when your, pet gets
Mhm.
to it,
Yeah.
yes, Martina, I agree. It is very expensive. And yes, I know. So I'm lucky that right now I haven't had a lot of issues with my pets, that I have not had to, see too many people. But a couple years ago,
I,
my
yeah.
beagle I spent like a car. So
Right, right.
so
It is expensive, and that's, one of the reasons we always want to, spend sensible money on the front end to support the best health so that, we have less likelihood of having to spend all this, money on healthcare to address it when there's a
and
problem.
to
But problems happen.
always learn, if you get an opportunity to come to the summit and learn, that's a great tool for a very inexpensive price to learn a lot of things. I know there's a lot of people who have online courses and various things that, you can take the step yourself to learn a lot of these things. So you have, a whole toolbox of your own to go back to. So
Exactly, exactly. There's so much baseline that people can create for themselves, in their own abilities to care for their pets. But it's good to know when you need to tap in
yeah,
outside of that and who to tap into,
yeah,
and one of the things sometimes too with even, you know, general practice veterinarians is just making sure that the proper testing has been done and that either the diagnosis is accurate or maybe the diagnosis hasn't been discovered because sometimes that's not, done to the best level too. So just knowing who to tap into and, who can you can create for your team of support, including yourself.
yes, absolutely. So, well, I'm so excited. July is going to be here before you know it. I'm going to drop that link at the end of this, with the link if you haven't signed up to get the first access tickets yet. We've got 5 speakers coming in July. One is you. We've
Yeah,
got Rita Hogan. We've got Susan Thixton, Amy Renz, Connor Brady. It's going to be just
gonna be
it's
fantastic.
all if you can think, one day of like 9 hours of just info, for a little over $100. I mean, yeah, you can't beat it. So I
Thank you.
cannot wait to see you in July. Martina, tickets will go on sale at 8 a.m. Eastern. So if you are watching from the Pacific, sorry guys, y'all gotta get about 5 o'clock in the morning to buy tickets. So set the alarms, and if you have signed up for tickets, I did send out an email yesterday with the link to the tickets. If you signed up and you did not get that email, please check your spam or your promotions inbox, or if you've ever unsubscribed from emails, you're going to need to re-sign up with another link, or another email. So make sure you can email me if you have questions there at info@nauticaldogva.com. But as Martina said a little while ago, we might just crash the internet one Tuesday morning. So
So awesome.
it's quite a big deal. So I'm so excited. Thank you for coming on. I'm sure you'll be back on before July with some more interesting things, because we're always learning, right? Like there's always something new going on.
Always.
And
Absolutely.
you never stop learning.
All the time. So thank you for having me on today to share
Thank
this.
you, Dr. Katie. And I'll see you in person in 7 months. So thanks for joining, you guys. We'll see you soon. Come back on Monday at 4 p.m. Eastern. Bye, guys.